Drug abuse by Tindu. Public health problem. Why does this problem exist in today's society? Drug abuse is due to misuse and addiction to the substance abuse, such as alcohol and cannabis. Drug abuse happens in today's society because of many reasons. One common reason is when you are depressed, you are more dependent on the substance to make you forget about your problems. Many people use drugs as a means to escape to their problems instead of dealing it with it head on. Another common reason is the start of the drug with just recreationally, but which becomes slowly more and more reliable to the point of addiction. How does this happen? The repeated exposure to the substance slowly causes dependency on it. Where does this happen? This happens in poor communities, which is more prevalent. Childhood neglect or abuse over a 10-year period may cause more than 70% of people to use and abuse drugs. Also, it's more likely in poor households because it's common for parents in poor households to abuse substances, which will affect their children negatively. Etiological factors: mental illnesses, family suffering and poverty, children who get neglected, Caucasian teenagers, and homeless. So in a survey of state welfare offices, 85% claimed parental drugs and or alcohol use of poverty were the top two problems in their child protective cases. 43.7 million Americans suffer from mental illnesses, and 29% of all people diagnosed with mental illnesses abuse drugs and or alcohol to cope with it. Also, the myth that African Americans do more drugs than Caucasians is false. Substance use and abuse are more common among Caucasians than African Americans. A study of 72,561 youths results in 37% of them engaging in substance use, 9% of which were whites compared to 5% being black. A 2010 report notes 34.7% of homeless people in shelters as having a chronic substance abuse problem, and 26.2% of the same population had a severe mental health disorder. Risk for community in the future. The next generation of youth will be doomed to repeat the same problems if we don't break the cycle. It's because drugs are becoming more and more easily accessible to our youth. With the legalization of cannabis, it allows teens to easily order online or off the shelf and risk having to abuse it. Although cigarettes age has now increased to 21 years plus, e-cigarettes are now becoming more and more accessible, with even higher nicotine content than cigarettes themselves. How to solve the problem. Strategy 1. Drug abuse prevention programs. Having these drug abuse prevention programs that are ready to help at any time is vital on helping these people recover from their abuse. HSA National Helpline is a free, confidential, 24/7, 365-day-a-year treatment referral and information services for individuals and families facing mental or substance use disorder. Trained information specialists answer calls, transfer, and have help centers ready on deck all the time. The term research-based means that these programs have been rationally designed based on current scientific evidence, so that strategy 2 would always be very reliable because there's research behind it. And these are rigorously tested and shown to produce positive results. Scientists have developed a broad range of programs that balance risk and protective factors in families. To help these working in drug prevention programs, NIDA, in cooperation with prevention scientists, presents many programs that are a variety of strategies proven to be effective. And with research, it demonstrates that over time, youth who participate in the programs have better outcomes than those who did not. How to solve the problem. A culture example is the Asian culture, which is that they emphasize the importance of education and the importance of not being hooked onto drugs. They make sure to scare their kids that their drugs could lead to a life of doom and addiction. Also, having a close relationship with their kids really does make a difference. Don't monitor them like you're their prison guard and they're a criminal. Monitor them by having a close relationship with them like you're their friend and they learn to trust you. Because you guys are on the same team, you aren't against them. This will allow them to be transparent with you and not have any ill feelings towards you, which can lead to rebellion. Study number 2 is Italy and France. Study shows that children in Italy and France have a healthy relationship with alcohol because they allow their kids to drink at an early age to practice self-control. Children in France drink wine a glass during dinner. Study shows that this makes them less likely to binge drink as adults or go out of control, since they are used to being exposed to it instead of illegally drinking it or waiting impatiently till 21 to go crazy, because they learn to understand the wine culture and not just do it to drink. Public health in the future. What does literacy say we should do? Well, the biggest effect when teens start using drugs is that is caused by peer pressure. No one likes to be left out, and teens and as well adults too find themselves doing things they normally wouldn't do just to fit in. So you should always have excuses ready available so that you wouldn't feel left out. Number two is to deal with the pressures, life pressures. People today are overworked and overwhelmed and often feel like a good break or reward is deserved. But in the end of the day, drugs only make life more stressful. And many of us all too often fail to recognize this in the moment. Try to prevent using drugs as a reward and find other outlets to relieve stress. Number three is mental illnesses. Seek help because substance abuse and mental illnesses go hand in hand. Those with a mental illness may turn to drugs as a way to ease the pain. Those suffering from a form of mental illness such as anxiety, depression, or PTSD should seek help by trained professionals for treatment before it leads to substance abuse. My opinion, to prevent this in the future, I think we should all have more funding for drug abuse and prevention programs, as well as awareness programs for parents to know what to do and understand that this is a big problem.